Let's talk about cervical exams. So cervical exams are intended to identify the dilation and effacement of the cervix as well as the station of the baby. Here is my dilation chart. Pretty cool. The thing is, everyone tends to put a lot of focus on identifying dilation, when dilation alone isn't really the most helpful thing to be looking for. That is because everyone dilates at a completely different rate. So you could be 3 centimeters dilated and jump to 10 centimeters in just a couple hours. Or you could be 7 centimeters and take all day to get to 10. I have been present at births where both of those circumstances unfolded. Typically, by the time someone reaches 5 centimeters dilated, they dilate much quicker, dilating about 1 centimeter an hour. This is the standard textbook, but it does not apply to everyone. So the other thing they're looking for when they do a cervical exam is the effacement of the cervix. First-time parents efface and then they dilate. Second-time parents efface and dilate at the same time. If your body is 70% effaced and 1 or 2 centimeters dilated, don't get too hung up on the 1 or 2 centimeters dilated part if you're a first-time parent. If you're 70% effaced, you're very close to 100. And once you get closer to 100, the body will dilate faster. So what is effacement? The cervix is long and hard. It's about as long as the thumb. As the cervix opens and dilates, it also becomes shorter. So the length of the cervix decreases until it becomes just a thin band of tissue, which is usually about 90% effaced. Once it's 100% effaced, the cervix disappears completely, making way for the baby to come through. The next thing you're looking for in a cervical exam is the station of the baby. The station of the baby refers to how engaged they are in the pelvis. You can learn more about fetal engagement and how the baby moves through the pelvis in the birth physiology module, the spinning babies module, and the cervical exam module. As the baby puts pressure on the cervix when they engage in the pelvis, contractions on the pressure of the baby helps the cervix to open and to efface. Cervical exams are also able to identify the position of the baby by feeling the sutures on their head. The front part of their head has a diamond-shaped suture, and the back part of their head has a triangle-shaped suture. This means that if a care provider were to perform a cervical exam, they could feel for the sutures on the baby. Then they would know if the baby is well applied to the cervix, which way the baby is facing, and if they're in an optimal position for birth. If they're not in an optimal position, this may help inform you of what spinning babies positions to perform to help your baby get into a good position. And you can learn more about that on the spinning babies module. So how is a cervical exam performed? Care providers will put on a glove, either a sterile glove or a non-sterile glove. They usually apply a little bit of lubricant to their fingers, and then they insert 2 fingers into the vagina and move them upwards until they find the cervix at the top of the vagina. When they find the cervix, they'll insert both fingers into it if it's open enough and spread the fingers apart, like this. And if they could only insert 1 finger, they know that person is probably only about 2 centimeters. When their finger is inside of the cervix, they can also feel the baby's head, so they can feel the position of the baby. They can feel how engaged the baby is in the pelvis, and they can also feel how effaced the cervix is. So when are cervical exams performed? Sometimes they're performed prenatally, sometimes they're performed during labor. Let's talk about the risks and benefits of exams being performed prenatally. Here are the benefits. Identifies the state of dilation and effacement present in the cervix. Satisfies curiosity. Identifies fetal engagement. Identifies if the baby is well applied to the cervix. Identifies fetal positioning. Identifies if the baby is head down, which may benefit someone who wants a head down confirmation and they don't want ultrasound technology to make that confirmation. Let's talk about the risks. Increases the risk of infection by pushing bacteria up past the cervix. And this risk is heightened for those who have an open bag of water. Increases the risk for premature rupture of membranes or PROM. This means that a care provider may accidentally break the water bag while they're performing a cervical exam. This is rare, but it is possible. The cervix is often in a posterior position, meaning it's pointing back before the person goes into labor or nears labor. As labor nears or begins, the cervix usually swings forward to be more in a midline position, which makes it a little bit easier to access the cervix during labor. Receiving an exam prenatally may mean that the cervix is a little bit far back, a little bit high up, a little more difficult to be able to access, which could cause the exam to be painful or uncomfortable. If someone has a painful or uncomfortable exam in pregnancy, it's unlikely that they'll feel comfortable about receiving exams during labor. Many people report feeling exposed or uncomfortable during exams. Many people are unaware of their right to refuse exams, and there's no evidence to support the routine use of exams in pregnancy. People often want to know the dilation of their cervix so that they can somehow guess as to when they're going to go into labor. If you want to induce labor, an exam may be helpful to give you some idea around if your body is already kind of preparing for labor and showing signs that labor is near. If your cervix is long and closed, it's unlikely that you're going to go into labor tomorrow, especially if the baby is also high up. But if the baby is engaged and they're in a good position and the cervix is opening and effacing, it's more likely that some sort of induction tool will be effective compared to someone whose cervix is long and closed and the baby is up high. Now let's talk about the risks and benefits of cervical exams in labor. The same benefits as earlier applies. Identifies all the things that we want to identify, the most important one being the position of the baby, because if we can identify that the baby is coming down a little bit to one side or the other, or not really in an optimal position, it can inform us as to which positions to support the birthing person in assuming to help the baby navigate the pelvis in a good way. It still increases the risk for infection in labor. It increases the risk for breaking someone's water during labor, which is known as AROM, or artificial rupture of membranes. Cervical exams may be uncomfortable or unwanted, which may be disruptive to someone in labor. Also, hearing the dilation number can put someone in a time-oriented space, which is really not an optimal space to be in when you're in labor. If you're concerned about this, you can definitely ask your provider to check your cervix and just tell you that you're making good progress. They don't have to give you the number if you think that it's going to be disappointing to hear or unhelpful in any way.